And the plan on the table now at least is a start to finally cleaning up a mess that our politicians have avoided for nearly 50 years. Joining us now, Republican Congressman Joe Wilson from South Carolina. Congressman, are we going to see bipartisanship on Thursday?
I hope so, and Dylan, it's an honor to be with you. And what I'm hoping on Thursday, and I need to point out something. You indicate that the Republicans had been involved. We were not involved. The bill that was presented to us on July the 14th was not one that came through committee. Republicans were not at all at the table in developing the bill. When it was considered before the Education and Labor Committee 2 days later, again, we had not been involved. When we offered amendments, and we offered, I thought, very constructive amendments, they were voted down largely by party line votes. Fortunately, one came through that I introduced that provided that if there was a government option that members of Congress must take it if it's so good. But we need to have, beginning Thursday, hopefully, you would take the Republican proposals, the President's proposal, and do a side-by-side. I've been on conference committees in the past. That's how you look and see where you have points of agreement. You pointed them out. You have about pre-existing conditions, portability, wellness programs. We all agree on those. And then you debate the issues you don't agree, and then you, in a conference committee, you take a vote, and then you have a final bill. That's the way it should work.
What are your thoughts on somebody like Paul Ryan's roadmap for health care reform, another member of the Republican Party, vouchers for one of the big things that strikes me about the employer-based health care system is that the tax subsidy is given to employers so that they can forego giving somebody like me or anybody else more compensation because they get a tax subsidy for health care. So they say, we'll give you health care instead of a raise because the health care costs the corporation less because they're getting the tax break. And in the process, the employees are denied any real opportunity to have portability in their own lives, not to mention real compensation. Paul Ryan, I think, has a brilliant idea, which is to take that tax subsidy away from corporations who use it basically to forego having to pay and to subordinate their employees, and to liberate people by giving individuals the tax break for their health care. This is also something that has been a feature piece of the Wyden-Bennett proposal, which is a long-standing bipartisan piece of legislation. Do you get the sense that the types of real change, structural change that would liberate people, reduce cost, increase quality, and add universal care, but would disrupt the special interests that are the insurance monopolies, drug companies, and employer-based healthcare system are possible with this Congress?
Well, actually, you and I agree on something, and that is that Paul Ryan is brilliant, and I hope you have him on more often because he really understands the issues. It really is substantive change. It provides for
do you agree
accessibility.
With him?
Yes, I do. In fact, and I spoke with him this morning. I said, hey, Paul, I'm really looking forward to you traveling the country and explaining your issues because he's addressing real issues. Last week, as I was working on promoting jobs in South Carolina, everywhere I went, people would ask about this issue, and I mentioned to them how fortunate we were to have good leaders like Paul Ryan, Mike Pence, and Eric Cantor.
What confuses me is whether I talk to somebody like yourself. I've talked to Representative Ryan in the past, and I suspect I'll talk to him again soon. I'll talk to Ron Wyden. I'll talk to Maria Cantwell. I'll talk to Democrats. I'll talk to Anthony Weiner from the House. Yes. And all of you will make very good sense in the conversation on the television. And you're very rational, and I can say, well, this is a problem. You say, yes, Dylan, that's right. You've observed the problem. For instance, look how big of a percentage of our budget health care is. Each piece of paper in these stacks, and this is the budget from the president, is worth $400 million. Each piece of paper is $400 million. The Republican plan cuts $68 billion. That's 17 pieces of paper, right? The one that was on the website. By the way, the Senate plan passed by the Democrats is not much better. And no one is dealing with the structural problem, which is the empowerment of special interests who profit by virtue of the fact that they have favorable treatment in the tax code, in the bidding process and in the disconnectedness of the relationship between patients and the cost of their health care. And neither the Republican plan or the Democratic plan has addressed any of those things, even though you or Paul Ryan or Ron Wyden or anybody else that I could talk will give me solutions. It never seems to be in any of the political proposals.
Well, actually it is. And I want to commend you for pointing out that we do have an alternative. It's H.R. 3400. And it does provide exactly what your concern is.
It doesn't, though, because it doesn't cover everybody. The issue with the Republican proposal is it does not cover 17% of the legal.
And we're going to disagree on that.
So anybody can save costs by not covering everybody.
No, it covers everyone because it provides access and affordability. And then for the insurance companies, it provides for buying insurance across state lines. Now, that really has been upsetting to the insurance companies, but that's what we proposed. And also, we've got reforms, and I really urge you to get Dr. Tom Price, who helped develop this bill. We've got physicians serving in the House. On the Education and Labor Committee, Dr. Price, Dr. Phil Rowe of Tennessee, who will let you know about TennCare. Dylan, you need to understand where there have been problems.
I'm familiar. Let me ask you one more question, because I have a theory.
Good.
Whether it's Wyden-Bennett, Paul Ryan's proposals, anything that really goes to the guts of the employer-based system, liberates individuals and allows us individually to have our health care wherever we may go and wherever we may work, gives us the tax subsidy, and allows us to directly interact with our doctor. The question that I have is this. Is the barrier to that the special interest that as labor and the unions in this country, who are the greatest beneficiary of, or one of the great beneficiaries of the employer-based health care system, because they uniquely were able to negotiate very favorable health care for their members and do not want to forego it in a reform of the actual system. Is that the problem?
Well, hey, no, I'm really grateful. I come from a right-to-work state. Our employees have the right to join a union or not. And so actually, the problems in my region, because we're a right-to-work region, are accessibility and affordability, and that's what we've tried to address.
I understand that, but the reason you have an accessibility and affordability issue is because the employer-based health care system is expensive and inefficient, and as a result, we spend 16–17% of our GDP on health care. You can see it's the biggest stack in the budget, and we're still perpetuating a system that was created during World War II when women had to come to work, and we are trying to create any situation in the middle of a war to try to benefit people, and we have not updated. It's 2010, Congressman.
Oh, hey, and I want to reform health insurance. We have the best health care system in the world. For every disease specific, we have the best health care anywhere in the world.
If you're rich, if you're stinking rich, you can get amazing health care. But the disparity in the quality and availability is stunning, and you and I both know that. I can get great health care because I've got good money. Honestly, I could probably get a villa with 3 doctors and palm trees. But I don't know about that. But most people can't get that. And I probably have to sell my house to afford that. But
hey, I'll take you to the poorest county in South Carolina, Allendale, a very nice hospital. I'll take you to another county which is very depressed.
South Carolina has the 33rd worst health care in America, according to the Commonwealth Fund. America has the most expensive health care in the world and the 37th highest quality. We pay more than any country in the world. We have huge amounts of money going to special interests. Our budget is dominated by the health care. And people don't have coverage.
No, according to the Associated Press, the reason for the rating that you just gave is due to education, lack of nutrition, and lack of exercise. We have the best health care system in the world.
For some people, yes.
We don't need a record. No, we have the best in the world.
For some people.
And I can take you to Allendale, I'll take you to Hampton, but we have a real problem with education.
You and I'm not going to listen. Let's do that argument another time. If you want to believe that everybody in America has the best health care, you're delusional, because there are too many people who do not have access to the millionaire-level health care. Listen, millionaires' health care is amazing. However, not everybody gets it. Let's do this another time. We've had a good conversation. I've had a time. It's a pleasure.
Best wishes. Thank you.
Thanks for the debate. Coming up on the Dylan Ratigan Show, we're breaking down a new plan to fix what may be the most unfair institution in America. And I'm not talking about health care, and I'm not talking about banks. I'm talking about the U.S. tax code, which works for the wealthy and against the worker of any kind. If you care about how much money you pay the government and what they do with it, you'll want to hear this next conversation. Plus,
nothing slows the